A few of the things I'm really happy for you. First of all, congratulations on, your business. Yay. And you look great in red, by the way. That's a great color. The red.
I'm feeling red these
Oh
days.
my God, look at me. I've got, of course, the red lipstick and I've got my red cup.
God, perfect. So, like, it's a moment for me.
Yes. It's totally a red moment.
So I think let's get started. In honor of everyone's time, it's a bit of a wonky time to even have this anyway, but I think it'll be good.
Okay, great.
Um, Thank you guys for joining. Your time today. I'm Onyetica. I'm the founder of Blue Nomad. And today we're really going to just talk about Botox, fillers, injectables, basically liquid anti-aging, if you will. Um, and Dr. Dana is just phenomenal. We'll talk a bit more about her background shortly, but would love for her to quickly introduce herself to the audience, and we'll get started there.
Cool. Well, thank you so much for having me. I'm Dr. Dana Khuthaila, a board certified plastic surgeon in New York City. I've been in practice for a very long time and specifically in this location for approximately almost 14 years now, going on 15. So my background in terms of what I do in plastic surgery, because I know this is like a broad field and so many people have different subspecialties within the specialty of plastic surgery. I focus mostly on the face, breast, and the abdomen. I was trained in microsurgery and breast reconstruction, but I do have a boutique practice in New York City where I like the one-to-one contact with my patients, not like kind of like a busy hospital practice, but it's I spend more time with my patients and tailor really what they need to like what I can provide for them instead of just doing all the trendy stuff that doesn't fit. It's not a one size fits all for everybody. And I kind of like it because I like the natural results, how happy the patients are after. And, this is my happy place in this kind of like crazy world right now. So I do truly love uh, to operate. I love being in the OR, and I really like my patients.
We like you too.
Oh, thank you. And I'm so proud because I've known you for a while now, and I'm just so proud of what you're doing, and especially in this field. And I, we had a talk before this, and I found you to be extremely brave. But that's great. Like the confidence and the aspiration is contagious. I feel like okay, we don't want to be intimidated by what's around us when there's like, oh, too much stuff going on. You just have to stay true to what you believe and what you're going to do and how you can make things better. That for me is just, and I see that in you. And, I wish you all the best. And I see that you're going to go places. I know it. All your dreams are going to come true. I feel it. Because you've got the dedication and you've got it. Like, you have the it and it's hard work, but yeah, skincare is super important.
Thank you so much. Maybe we start with how you and I met. I love telling the story because I think it speaks to why you're even here talking to this audience. So this was maybe 2019. I don't know, like this was before 30.
Mm-hmm.
So I was like, okay, I'm turning 30 or I'm on the way to turning 30. I need to start getting preventative Botox. It's because, you're hearing all these buzzwords. So you walked into your office and you were very kind. I think I remember you just saying, hey, I really don't think you need this.
Mm-hmm.
You heard me out, but it was sort of around like, let's level set. I don't think you need this. But if you do feel strongly about it, come back, not the next week, the next month. You said to come back in a year.
Mm-hmm.
I think that was remarkable and really speaks to your level of integrity. You won my admiration then. Of course, I came back a year later. You still felt strongly about your thoughts, but you obliged, and so I think yeah, let's talk about before we get into talking about all the cosmetic work. I really do want to share a bit of your background. I think you were quite humble in introducing yourself. And so I'm going to read a quick bio that I've scoured the internet to pick up on. And so Dr. Dana is an exceptional plastic and reconstructive surgeon whose expertise spans continents and cultures. She's both fluent in English and Arabic, and in addition to being based here in New York City, serves as a visiting surgeon in Kuwait, Dubai, and Qatar, consistently delivering natural and stunning results. She's been recognized for her excellence by the New York Times as one of the super doctors in plastic surgery for several years consecutively. Dr. Dana brings a wealth of experience in both aesthetic enhancements, or I call them micro tweakments, to more complex reconstructive procedures, think your mommy makeovers. So she really just runs the full breadth of aesthetics. And she has honed her expertise training across regions, so from the US to Canada to Brazil, Belgium, Italy. She's sort of all over. And I think it's really important because you're able to really talk about how beauty and wellness is received across cultures. And so perhaps we sort of segue into how did you get started? Like what about your upbringing? Where did you grow up? What about just like your formative years led you into a career in plastic surgery?
Well, thank you so much for that introduction. I mean, I believe that I had an interest generally, and I think, this is kind of, it's not a cliche, but, just to help people, and I just didn't know how. And I love the idea of medicine, but I didn't know in what the different specialties were. So I finished medicine. I had a rotating internship where the first rotation was actually plastics, and that's when I fell in love with plastics. The idea of helping people of different ages, different backgrounds, and men and women, as opposed to like gynecology or pediatrics, limited by an age group or gender. And I loved the reconstructive aspect of it because I found it to be very creative. And then I went into plastics in Toronto, McMaster in Canada. I did a fellowship. I also traveled, as you said, I did fellowships in Brazil, in Belgium, and Italy, Milan. But that was more focused on aesthetic and then also reconstructive breast care. And I still, as much as it's hard to practice medicine around the world, I've seen what other people have, I've learned from different environments, like, big institutions. I love teaching. I love interacting with people. And then when I came to New York, and to really kind of make my own environment in terms of like, I want to have the contact with my patients. I want to spend time with my patients. I want to hear them out. It just didn't want it to be kind of like a cookie cutter where it's just more and more and more, and less time and quality time with. So I think I finally kind of found my sweet spot where I do the cases that I love to do, and to also, having like be responsible for patients' transformations in a positive way, whether they've lost weight and they need that extra skin tightening, it's for the abdomen, arms, or breast, mommy makeovers. So I just like to be part of their to kind of feel better about themselves. Yeah, and I, I mean, it's just, it seems like it's a lot and it's a very long journey. But I feel very privileged to, continue to meet and have met like amazing people along the way.
Awesome. Thank you for that. Let's talk about your current practice day to day, specifically around the face, right? Everyone is obsessed with looking younger. First of all, like, what is your whole philosophy around aesthetics? That's number one. And then, when giving people Botox, fillers, or maybe neuromodulators, because I know, and we're going to get into this because you're not Botox. Like let's talk about what you see day to day. What's your general thoughts and feelings?
I don't think our faces are trends. Their faces are special, and they're so I like to hone in on that and just say, okay, what makes each individual face beautiful, unique, how we can emphasize certain, areas in the face. And I kind of break it down into thirds. But my whole, like, the top third, middle third, lower third, and see how I can help each individual part of the face with neuromodulators. So I look at all these aspects of the face, but my overall philosophy is less is more. I don't want people to do, some people have been given advice to put more in and then they can kind of like dissolve it, or I don't like that concept. I like the concept of doing baby steps. And so the person is comfortable with how they look. I want them to look like themselves, but better. So it's more like the natural look. And you said that in your introduction as part of like you felt the pressure to do something even though you didn't need it. And I want to be like, the your doctor friend to tell you, okay, well, let's just wait and see when you actually need it, because it's not like fillers are not for everybody, and Botox isn't for everybody. People don't accept the idea of having these cosmetic procedures done to them just because everybody else is doing it. So there's a lot of social pressure to do more, to sell more, to have more. And I feel like I'm on the other side of that. It's just like moderation, and also to tailor each individual procedure to the patient and what they need. And that can be different from one person to the next, depending on their race, on their age, which age is really important. And some people in their 30s look older and some people don't, because they have good skin texture, they have good, derm. Genetics plays a major role. I really find that really looking at the patient, it's kind of an art form. It's like, okay, now I see what you need. And I mean, it is available now, and there's a lot of pressure to do so many people do it all around the city that, they feel like, okay, we should do it too. But I also think that with neuromodulators and fillers and a lot of facial stuff, it's almost like makeup. It's available, but you almost have to have that cosmetic eye to use it in the right place for it to look natural and not look overdone.
Yeah, no, I totally agree. And
Genetics, we're kind of born with it. We're lucky. If you're lucky, you have it. But then other things that you have more control over, those are the key things to hydrate more. And we're going to talk more about skincare, which is really important, because all the stuff that I do is more invasive and it's like under the skin with needles and procedures. But it's really important, the covering of our body is the skin, and it's the largest organ in the body. And our faces are extremely important in terms of interacting with other people, socializing, finding jobs, and lifestyle, and certain things that people do. For example, when everyone went on Zoom, everybody started looking at their faces, and then they noticed all these positions, or like submental area in the chin area, where a lot of people are complaining about that because they kept seeing it because they're looking down. And then also the transverse, like the lines in the neck, or if they're scowling, and then they have the lines in the glabella. So people started noticing that more, and it's okay to use certain products to help with that. So, and we're not going to stop aging, and that's just being alive. We want to stay alive and well, but we want to look less tired. We want to look less worn out, and we want to look refreshed. I think that's what those products, where they come in, and they just become part of our maintenance. Like, if you're going to do your hair and nails, you can just also do your face, and kind of in a very nice, tasteful manner.
okay. And when you think about skincare, like what is the core, right? I think there's so many perspectives on skincare.
Yeah.
It's ridiculous.
Well, I do believe that, the core essentials is to protect, and that's protection from the sun. Number two is protecting also internally, like your body. Like, smoking have harmful effects on the skin, and it can also have a hue of the skin. So that is the protection part. Number one, and number two is hydrating, because you need the hydration, whether, again, the whole body, and also hydrating the skin. And number three would be maintaining it. Like, if whatever it is, it's good, you just kind of maintain whatever works for you. And then part of the prevention and protection is preventing, like, say, fine lines, such as using Retin-A. And that would be group when you start to use that to prevent having lines. And I don't think it's completely 100% preventable, but it should just minimize. So those are things that I look at, and I do protect. I wear sunblock or sunscreen from the sun. I also hydrate as much as possible, especially in the winter when everything like the heat, like, indoors is dry. And I use Retin-A, on and off. I'm not really like, it dries the skin. So every now and then, if I need to, I use it and then stop and then go back and use it again. Also, there's some like vitamin C serums for pigmentation. Um, those are also good. I mean, there's like a whole array of products out there, and you're better at this than, the kind of describing and diagnosing. Kind of key to first diagnose which each individual person needs, and then you can give them what they can maintain. Because if it's too many steps, practically speaking, I don't think a lot of people can do like 6 or 7 steps every morning.
But I mean, when you look at what's happening in the market, it's very multi-step driven, and so it's definitely good to hear that from you, that you just need the essentials.
Yeah. And essentials, and if you have more time at night, like do them at night. Have more time, because everyone's rushed in the morning and they're trying to get out and get stuff done. I would say sunblock is something I don't leave the house without. Of course, hydrating first. Whether it's I like deeper creams, and lately I've been actually using oils, but I use those at night. So because throughout the night, the face does get, dry up. And then in the morning, it's mostly like a lotion, and then like a deep and sunblock or sunscreen. So those are my essentials for like morning after a cleanse.
We'll get all that stuff later. Let's talk about neuromodulators.
Mm-hmm.
So we've decided that, okay, we're doing skincare, but we still want Botox, we want a neuromodulator. Like, what's the best way to go about it? I think nowadays, I mean, there is a proliferation of providers,
Mm-hmm.
doctors. People aren't super educated on how to go about getting this drug onto their face, what the pros and cons are, just how to think about it, right? So now we've gone past, like, the skincare, the more preventative aspect of maintenance, or well aging, if you will. And now you want to look fresher with more invasive work.
Mm-hmm.
What's the way to go about it? But from a provider standpoint, from a technique or drug standpoint, like, how should one think about this?
Mm-hmm.
I think it's something that I get a ton of questions around, and would love to hear your thoughts on it.
Well, I mean, there's a lot, like, people are bombarded with, like, the idea of Botox, and a lot of people actually misunderstand what it does. So they think like, oh, Botox, like in the nasolabial folds, and it's like because it's a brand name and they're pushing to have it, like, it's really popular, but they don't know what it does. So with the neuromodulators, basically what they are they paralyze the muscles. So they're poisons or toxins that are injected into a muscle, and it has to be a muscle because that's where it's up the muscle. And then when it paralyzes the muscle, then there's no movement, and so the lines don't form in the skin. So wherever there are lines in the face, like the forehead lines, the transverse lines, also around the eyes, crow's feet, sometimes bunny lines around here, and then the glabella, which the area between the brows. Those are the most common sites. There are other sites, such as, like, the neck here, the platysma, but it has to be in a muscle. So the idea is muscle to paralyze it, skin doesn't contract, and you don't get lines. Now that can start, I think it should be concurrent with using skincare. I think skincare has to be ongoing, and then you can use intermittently the Botox and the neuromodulators. There are several brand names. Botox was the first one to, come into the market. Now there's Dysport, Jeuveau, and Xeomin. I actually prefer Xeomin. I've used them all, and the reason why I like it is that it is the purest form of botulinum toxin because it doesn't have the proteins that need to be broken down for it to work. So it can work within like 5 days. Whereas, like, overall generally takes Botox a week, 7 to 8 days to fully take effect. It also, people don't have what they call a resistance to it, meaning that not every time you get Botox and over time you need to use higher units or more units because you're resistant to the proteins that Botox. So it has to degrade for the Botox, the actual Botox product to take effect. So I like it. That's the one I use. I inject myself. And I also, change it up for me, for instance, is you just inject it where it's needed. Meaning that if, it doesn't have to be every 3 months, it's really tailor made and for the individual. Some people have more lines, laugh lines, or some people have lines here, or some people even have chin lines. Like not chin lines, but the muscle goes like this and it contracts and they need to relax it. So when I look at the face, I'm like, okay, how can I have this product, which is part of my, armamentarium of like of the face and refreshing it, and where can I use it? So most common areas here around the eyes, forehead, and the chin area. And I personally don't like to use it too close to the mouth because some people do like the lip flips and I find that number one, even if it were used in areas that are highly mobile, it goes away so quickly. So it's almost like not even worth it. And so I like to use it in areas where you see the effect for a longer period of time and you'll appreciate it. It also is considered like a pause on the movement of the muscles. So if you think about it, yes, it paralyzes, but it's just a pause. And then when the effect is gone, you're going to get the muscle movement. So in a sense, it kind of like prolongs or maintains, kind of like, makes it a very nice transitional aging process rather than, and you don't want to look fake the whole time. So I do appreciate that it wears off. It's okay if you take a month with facial expressions and then come back and get it, get the Botox.
Okay. So let's talk about frequency, right? Some people get it religiously every 3 months. Like, what's the right frequency? I mean, my whole thought process is that if you just get it once a year, there's a cumulative benefit. When you're like, I don't know, 60, 70, you would erase a few lines, but that's just my thought process. I'm not of the belief of getting it regularly.
Mm-hmm.
I'd love to hear your thoughts on it. And I think it's also individual, right? What's the best way to approach the frequency of the injections?
Well, it depends on like again, it is based on the individual. I don't like the idea of having it every 3 months on the dot. Like, oh, it's not, it's not, you don't have to do it that frequent. I would say maybe like if you don't want to see lines, and it also depends on people who don't want to see lines, don't want to see movement. Like, they prefer themselves that way without any expression. So that would be about, between 3 to 4 months, they can come in and they can have it redone. And then there are people who don't mind it. Like, they go 4 months and they're like, oh, now I think I need it. So they come back and we can get it like twice a year, 2 to 3 times a year is cool. And I've skipped sometimes where I've done it like here, I see it, and I don't see any lines in my forehead. So I skip that. And then maybe with the following injection, I would inject the forehead. So I guess it depends on the individual and their needs, but I'm not, it's not an antibiotic where it has to be taken at a certain time every time. And I also like to see facial expressions when I use the Botox because I want people to animate, and not too much, but at least you'll know if they're happy or not. I have mothers who want to scowl at their children, and I want them to kind of like, for them to see it, but without that forceful scowl, just to soften things up in the face.
I'd love to hear your thoughts around like just provider selection so that people are a bit more informed when to partner with someone.
Well, I do think, of course, you should go to a medical professional, and a medical professional who knows, who's done this, and has been doing it or has experience in doing it. Because I understand that there's a lot of, it's very popular push to get these injectables, and some people take, courses to do it, and they're, I guess, new learners, and then there's I guess there's a learning curve too. So you just have to pick and prices. We just have to discuss it because there's a cost thing and also a timing thing and availability and convenience. I mean, that it all comes into play. But I think if you feel comfortable, and I am okay with people having multiple consultations until they find the right person to do it, the right medical professional, somebody who understands their facial expressions, someone who understands, and sees them and kind of, they figure it out, feel comfortable. But definitely a medical professional. You know, there are some plastic surgeons that don't do Botox and fillers. There are some, and there are other professionals that do. So you just have to pick a safe doctor to do it. Also somebody who has the same aesthetic, you know, look that you want, and not somebody who's going to use too much and make you look uncomfortable. I've had many people who've come in and they're like, well, we've tried it once and we didn't like it because they used too much and they didn't like the way they looked. They didn't like the results. So you almost have to understand your patient. But for those people looking for someone, I think asking around, and also seeing photographs, and just doing a lot of research. And look, I get it. It's really hard because, you know, I personally think you go to the person, like, you know, research the person, not so much the place, if you know what I mean. Like, you're not going to just, and I don't want to name any names, but it's just like, oh, you're going to a particular place without knowing who's going to inject you because they marketed it. And I think that's a good place to start. Start looking at the individual who's actually going to inject you and research them. So, because if you just make an appointment with someone you don't know and you're going to get, then, you know, you just need to be prepared.
That's really helpful because especially with the rise of the Botox bars, you're kind of just brand. And I think it might be a little bit more challenging to research the person because again, they market the brand, but I think there's always information online. So that's really helpful. Segueing away from Botox, let's talk about fillers.
Yes.
About them. I think Botox has more data around the results, pros, cons, etc. Fillers, it's a bit of a new development in the world of anti-aging. So can we talk about, yeah, fillers? What are your thoughts on them? How to use them? What do you like about them? What do you wish they behaved more like? Would just love to hear like your general around fillers.
Well, look, again, fillers is part of our, you know, what we use for facial rejuvenation, but it needs to be also done in moderation. Meaning that, you know, a lot of the marketing that's out there is that fillers will pull this. Like if you fill this or you fill it here, it's going to. There's a lot of misinformation about it. Fillers are for volume. So if you, and you know, aging, aging is a process where everything goes down because of gravity, but also there's loss of volume. So you want to restore volume in an area that's lost it, but you don't want to overdo it because then you have like a puffy face. And you also don't want to, you know, market that fillers will lift, because anything that has a weight will drop and it will also be bulky. So I see that a lot, and I just don't want to like it's not even a misconception because it doesn't even do it. It's basically, it's just a filler only fills. So you have to place it in areas where that's what you want. You actually want volume. And there are different kinds of fillers. There are, for example, the hyaluronic acid fillers, which are the clear fillers, and they come in different brand names. There's also the Radiesse, which is a calcium hydroxyapatite. That has a benefit because it has calcium, so it's thicker. You can dilute it, but if you use it in a thick form, you can use it like right on bone, like in the cheek area, in the jawline area, to really, it stays much longer, it lasts much longer, and it has like more of a substance. Whereas the hyaluronic acid ones, which are clear, they can be around the mouth, they can be around the laugh lines, temple areas. I started kind of shying away from putting injectables in the under eye or the tear troughs, because then that can cause a lot of puffiness. And I mean, we've seen it in some celebrities like Kylie Jenner, who had it, and she was really young and she had it, but she looked really puffy. So I don't know if they dissolved it, but you know, some areas don't need fillers. And it would be ideal to just fill like the cheek to lift it up. And this is where the cosmetic and the aesthetic, you know, appreciation and also understanding the anatomy is key. And I think fillers are a little more challenging to know which filler to use, where to use it, and how often to use it. And experience is key in fillers. And in this case, I would suggest going to an actual actual, facial plastic surgeon, someone who is a medical doctor who understands how to do it, but is also there if a complication arises and can treat the complication. Because if everything goes well, it's, nice and dandy, but if it's not, then you need somebody who can actually help you get out of the situation that you're in and know what to do.
That's helpful. What's like the biggest complication that one can get out of fillers?
It's pretty scary. And then the literature actually shows blindness that can come from fillers, because it goes into a vessel, it goes into the artery. There are areas that grows, and it's a word for basically like death of tissue. That can happen sometimes around the lips. So those are serious consequences that can happen if not treated early. And it can happen best of best of hands, where inadvertent complication, but you just need to know to recognize it, diagnose it, and also make sure that you know how to treat it well and quickly, very quickly.
Wow.
Yeah.
That I think you told me that it can cause blindness, but I totally forgot about that bit.
Yeah.
And what about people who, I had a question that just skipped my mind, but so let's say, you're not a good candidate for fillers, right? So you just mentioned that you're not a fan of injecting them in the under eyes, which is a region that people are always looking to rejuvenate.
Yeah.
What the options exist for someone who's not able to get Botox, get fillers? Can you share some thoughts around that?
Well, I think people can mistake sometimes the hollowness with the darkness of the eyes. And so when they're dark, they almost appear hollow. So the examination is key to see, well, what is the initial issue? Is it because that area under the eyes is actually dark? Now, this could be something that could be from lack of sleep, being tired, being dehydrated. Also veins that are in that skin, like under the eyes. There are many veins that give like a bluish hue or a dark hue. These can be treated with, if it's not a hollow, it's a color issue. So treated with like laser. It can be treated by people who have allergies. Maybe it's like an allergy issue. Whereas if you have a true hollowness, that is something that, yes, you can. And also, where is it exactly? Because sometimes it's like in the cheek and it draws down like the whole, and you won't see the hollow as much. So it's almost like trying to figure out what the actual cause is and addressing it instead of just like, injecting everybody in the or the tear troughs, because I don't think we need it that much. I mean, even patients who I see a little hollow, but if I inject like peek underneath, and that's very supportive, you see the hollow, it's less. And I've also paid attention to young kids, like my son, and young. If you look at their faces, they do have that hollowness. It's not supposed to be like straight and flat. And I think also our expectations should be managed in a sense that we should have realistic expectations of what faces should look like. Not everyone's face naturally should look like they've had makeup on or fillers on or overdone. So staying within the natural parameters and is always safe. And going back to what I said before, it's like less is more, because then you still have the facial expressions, and also not a telltale sign that something has been done, but look refreshed and better.
Totally agree there. One more question on fillers. Do they dissolve? Like,
That's
the medical data around, I know a lot of people have had terrible experiences with them. They get them dissolved, but literature that they don't ever really dissolve. Like, what's the truth around fillers?
Yeah. Well, it kind of depends on the filler, because we know that hyaluronic acid fillers should dissolve. That's the whole idea of the hyaluronic acid. They are dissolvable. They do dissolve. So there are other fillers that last longer, but it takes them longer to dissolve. Now, unfortunately, years ago, there were fillers that did not dissolve, and they were attractive to people who did not want to come back routinely for fillers. So they wanted a non-dissolvable filler. And I say, please stay away from anything permanent in the face, like besides an implant, because you cannot have, because the face is going to continuously change. And as we age, so you don't want something either stuck up here or stuck down here, those that don't dissolve actually migrate. Whereas the majority of the fillers should dissolve. I do believe, however, that they do something to the anatomy when they're injected. Like, for example, the idea of fillers is to attract fluid. So the area becomes like puffy, and there may be an element of scar tissue if they're repeated so many times, so that it does change kind of like the what's in there, and you think the filler's in there, but it's mostly gone. All right.
I think we've covered Botox and fillers.
We have. Let's talk about skincare. Like, you talk about your basically in terms of skincare, because I think it's, we have to work from like the inside out, where you have the base on like the inside, and then the skin, you have to work on the skin, like, it's just like a process where you moisturize, you take care of the skin, you prevent further wrinkles with Retin-A, maybe use microneedling, because there's so much out there right now. Like, it's just,
in terms of skincare, I really agree with your philosophy around less is more. And again, if you are really curious about going to, but it's really around keeping a routine that you can actually keep up with. Mm-hmm. I think your trends, K-beauty is really well known for having multi-steps, 10 and upwards, right? And so it's really cleanse, right? Like, get a good cleanse that doesn't dry out. We've heard a lot around barrier compromisation. You don't want to dehydrate your skin. If you dehydrate your skin, you're going to break out. It doesn't work, right? Like, your skin, I believe it really does heal itself if you have the right environment. So yeah, I think it's really just around like a good cleanse. And if there's one problem like you're looking to solve for, whether it's, I think we're always wanting to solve for lines and pigmentation and like dullness, and we want to solve for multiple things. I pick like one or two things maximum, right? Get one serum that solves for that one particular issue that you're looking to treat. Right. And if you have acne and if you have pigmentation, maybe you prioritize, right? And then you just solve for the acne first, and then you can deal with pigmentation, or you can do both in tandem. But again, don't try to overcomplicate your regimen. A good moisturizer, it goes without saying, you want to always like keep the skin locked in. SPF. I've seen a lot of sun damage. I think it's just really around having a routine that you can stick to, that you enjoy doing, and then getting consultations from an expert when you see something that you're not too happy with, right? And that's kind of like how I approach skincare. But I think that's obviously topically. I think internally, trying to get some sleep, this is something I really struggle with, and I'm looking to fix, because I see weeks that I get good sleep, the darkness, hollowness looks better. Like, it correlates to lifestyle. I think it's a solving question for me. How does one do skincare, live a healthy lifestyle, and appear refreshed and rejuvenated all the time? I think it's challenging still.
I mean, it definitely is, and it changes throughout one's life too. Like, you can have stressful times when you're studying and you're going through a lot of stress, you're up at night, and then you also have different part, like, as a mother, you're also up at night with your children, and you're also going through hormonal changes, and that affects your skin. And so you just have to, I think I would just say, just be kind to yourself and take it easy. Do the essentials, which is just like, breathe, eat well, sleep well. I mean, at the end of the day, it does go back to like, just staying alive. And I know de-stressing sounds easy, and well, not easy, but people use it a lot, but it's like the most difficult thing. I think we are also on a heightened level of cortisol, which is the fight or flight hormone that should be like, it goes up and it goes down. But if we don't give it a chance to go down and go back to like, a baseline, a regular baseline, and get enough rest, and we say sleep, but sometimes sleep isn't enough, because it's not restful sleep. It's also, sleep with like medication, whatever. Like, it's almost like we have to detox ourselves, and then kind of like start from the beginning, and let's like, okay, let's see, we have to, do the right things, and then I feel like we're constantly bombarded with so much that we declutter all the stuff, and we sometimes bring it on to ourselves, like, oh, I could do this, I can go to 3 2 events, whatever, I can push myself because that was the work hard culture of like, we could do it, we can, have it all we have to do is just push. And I think we're going into a different topic altogether here. But I think
actually a good segue into like a quick let's say rapid fire questions on you and like self-care rituals, and then we'll spend a few minutes asking, I think there's some audience questions, and then we'll wrap things up. I didn't realize it would go for an hour.
I can't see, actually. Can you see the questions or the audience and who's here? I've like frozen in a...
I pinned some of them, and then I think some were probably DM'd actually. So I have a sheet here. So Dr. Dana, what is your self-care ritual? Like, how do you de-stress? Your mom, your plastic surgeon, you live in New York City. Like, how do you get your zen?
Well, you know what? I had to figure it out for myself, because a lot of people's like, oh, go for a massage, and then you'll de-stress. Actually, massages stress me more, and I'll explain why. The massages, I know, I realized that my mind is what needs to be still, not my body. And during a massage, my body is like, my body's still and getting massaged, but my mind is on overdrive. I don't sleep during massages, so that's not good. So for me, to keep this quiet is to read, and also to exercise, because I'm like following the next, like in a class where I'm following the next step, and praying. So those are my 3 things, like to keep, which is to occupy my mind into a quieter zone, or to do something else where I'm not overthinking. So that's basically, it took me a while to figure it out, but that's it for me.
I totally actually agree with you on the massage bit. I don't sleep. I go because they relax. It relaxes
body. Yeah.
About like 10,000
Yeah.
things. That's helpful to share. Where do you find inspiration? I think your work is both artistic and art and science. And just, like, where do you find inspiration in general? Could you share a bit more on that?
Oh, I have to say that I find inspiration in people, like generally, like, their stories. And I'm very lucky that I do spend a lot of time with my patients, and I hear their stories. What are their reasons for doing what they're doing? Why are they, seeking a surgeon? And I also get inspiration from just nature. Like if I want some quiet time, and we don't do that a lot in the city, but we don't have a lot of access to, going out there, fresh breath, and like taking nature in. But I enjoy that. I think as I'm getting older, I do enjoy nature more. Like I'd like to garden or whatever. Like, I don't have a garden, but in the near future, I just want like space and quiet and peacefulness. And I think people are amazing. I think, just finding people who have overcome, like we all go through difficult things in our lives, and then just finding the stories and more, and educating myself, whether it's history or that, just kind of gives me it's like people have done it before, we can overcome these things, and that inspires me to keep doing what I'm doing.
I love it. What's your favorite place to travel to outside of New York?
Oh, wow. Well, I have several places. I love Italy because I was there like just last year. I love their food. I love their culture. Italy, just in general, is amazing. And then I go to work to Qatar, Kuwait, and I love visiting them because it's just a different culture and it's so beautiful. The people are just so generous. It's also different foods. And the weather is different, so I like to, that's also inspiring in a sense, to see such a stark difference in just overall life. It's much slower than it is in New York, and that just calms me down too, so I like that.
Actually, I wanted to ask, do you, especially when it comes to like aesthetic treatment, is there like a cultural difference in the type of work that you do over in the Middle East versus here in New York? Like, what are the cultural differences when it comes to aesthetic medicine? Would love to hear your thoughts on that, or your experience rather.
I mean, absolutely, there is a difference. It's kind of like, you know, the Florida experience in terms of like, you know, how different Florida is to New York, and also Florida or like California is to New York. I think in New York we're just like, you know, modest in terms of like what we do because we're very like practical. I guess in other parts of the world they see plastic surgery as, you know, they take it to like an extreme, or they do more, or they want it to show. And it took a while for me to just kind of like, you know, my style is different from maybe what the push is, because they're very like they're on trend, and sometimes trendy isn't always appropriate for each individual person. You know, I don't operate on young women who don't know what they want and they present themselves and they're like, you know, what should I do? You tell me. I'm like, I'm not in a to tell you what you need. I mean, I can do the things, but it has to come from you. I don't like, you know, anyone being pressured into doing plastic surgery for a certain reason. So I'm kind of very, and people have asked me if I've said no to consult, like to procedures, and I do it all the time actually, because I don't want it to be done for the wrong reasons. So I think, yeah, there's more like the trendier, more push to do more procedures and to make them look very obvious, whereas I'm more of like the conservative natural approach. But even in New York you get both, you can see both, but that's kind of like my taste in the cosmetic world.
That's interesting. Do you think the maximalist approach, is it more of a status thing? Like what do you imagine, like what drives that desire to make it be more
Well,
obvious?
I think it's also because plastic surgery used to be for a specific subgroup of people previously, and now it's readily available to everyone. And it is like, you know, when a lot of people get plastic surgery, they want to show that they're also in on what other people are doing. So they want it to show. It's like, oh, I had my done. You know, you can see it. Um, and everyone is they want in on the trend, and so they want, like, if I do something and it doesn't show, they're not going to be happy, because they want to show off to their friends that they've had it. And that's because it's readily available to pretty much a lot of people and affordable. It may or may not be done correctly, but they want to show that they're also in on the trend. And then it's kind of like if you have the it bag or the shoes or whatever, they want people to notice it, that, you know, that they've had something done. And so that makes it more of the actual procedure, but is it the right for the person? And this is where I draw the line and say,
So we have a couple of questions.
mm-hmm,
There, a lot of them are skincare related, guys, and so I'll probably just DM you, just to be mindful of time. But one that you could possibly help with, I know you prescribe retinol.
mm-hmm,
Which when someone, retinol is a very tretinoin, retin-A, there's so many derivatives of them.
mm-hmm.
Um, I think Lynette asked about retinol, like how should one think about retinol, when to introduce it, which one to get. Could you share more thoughts?
Yeah, so I do prescribe Retin-A. Prescribe at a lower dose. It's 0.05%. You know, whether the cream or the gel, I prefer the cream. And it's for those women who come in like their 30s and they want to prevent fine lines. You also have to be careful that you're not in the baby making phase, because it could have a harmful effect on like babies or anyone who's pregnant. So, you know, 30s, 40s, and 50s, that is, I think, ideal. But I am also someone who doesn't use it like religiously every single day. It's used, I prefer at night, because it's also photosensitive. So don't use it in the morning or during the day, or if you're going out. And use it sparingly, like meaning maybe during the week, not every night, but like three times a week. Or if you want to use it for like, you know, 5 straight nights, and then if your skin is too dry, then you take, you know, a few days off without applying anything. You kind of tailor it to how you feel more comfortable, and kind of understanding your skin and how, if it breaks out. Now, if it breaks out, that's something that is expected after that, because it does extract, like it helps to bring things to the surface. But I think Retin-A is a great product.
Cool. Lynette, I hope that was helpful. I will follow up with you personally on that. We're at 1:59. It's 2 o'clock. So maybe we should wrap things up now. But this was great, Dr. Dana. I really you coming on here. Maybe we'll do more of these. I know that we're doing a giveaway, and so we'll follow up offline there. But I really enjoyed this first chat.
Thank you. And I also wonder, like, what is a good time for lives? Because I know people are at work and usually is it, I don't know if people do lives like more in the evening or people are, I mean, I always wonder about that.
Probably evenings, but I think it's sort of like when we can find time.
Yeah.
And whoever can make it. And the good thing is that we're gonna record. It's recorded, so we can like recycle the content. But I would say the main objective here. But thank you guys for all joining. Before we get into the conversation,
it's always wonderful to speak with you.
Always. We'll chat soon.
All right. Take care.
Oh.
Bye. Thank you.